Vice Chancellor, Professor Dr. Zamri Radzi, and when our national anthem and songs are played. Please stay back for the photo session after the lecture. Your cooperative is greatly appreciated and your participation is very welcome. We will begin shortly at 3 p.m. and for those joining us on YouTube, we invite you to leave your greetings in the comment section. Thank you so much. Ladies and gentlemen, I would like to welcome the arrival of Yang Berusaha, Professor Dr. Zamri Radzi, Deputy Vice Chancellor, Student Affairs, University Malaya, accompanied by Professor Dr. Kheong, Professor of Medicine, Faculty of Medicine, University Malaya. If I may invite you to take a seat, Professor Dr. Zamri and Professor Dr. Chan, along with the audience. Okay. Salam sejahtera diucapkan kepada semua hadirin yang dihormati sekalian. Selamat datang ke Syarahan Perdana Profesor Dr. Chan Wah Kheong pada hari yang berbahagia ini. Izinkan saya untuk tertutur dalam bahasa Inggeris untuk sama-sama menghormati dan meraihkan para hadirin daripada luar negara. Ladies and gentlemen, I would like to extend our warmest welcome Yang Berusaha Professor Dr. Zamri Radzi, Deputy Vice Chancellor, Student Affairs, University Malaya. Yang Bahagia Professor Datuk Dr. Yang Faridah Abdul Aziz, Dean of Faculty of Medicine. Yang Berusaha Professor Dr. Chan Wah Kheong, Professor of Medicine, Faculty of Medicine, University Malaya. Yang Berusaha Professor Raja Effendi, Raja Ali Dean of School of Medicine and Life Sciences, Sunway University, Management of Faculty of Medicine, Management of University Malaya Medical Center. Distinguished guests, Professor, doctors, ladies and gentlemen who are joining the inaugural lecture virtually and physically. I'm Keith and I'm honored to be Master of Ceremony for the inaugural lecture for my inspired colleague, Professor Dr. Chan, who profoundly shaped not only my own journey, but also in the field of gastroenterology and hepatology. I first encountered Professor Chan as a student, and he has the unique ability to break down the most intrinsic topic that not only educated but inspired. A professor inaugural lecture is one of the University Malaya cherished traditions. The lecture honors the professional journey taken by our professor and provides an opportunity for them to share their wisdom, inspiration, and philosophies. We are grateful to be here today as an audience for this inaugural lecture by Professor Dr. Chan Wah Kheong, a committed and enthusiastic professor of medicine in the Department of Medicine, Faculty of Medicine, University Malaya. Today, Professor Chan will share his journey in the field with us in this inaugural lecture entitled My Journey in Fatty Liver Research, Adding Value, Collaboration, and Paying Forward. So without further ado, I would like to invite the Yang Berusaha Professor Dr. Zamri, the Deputy Vice Chancellor, University of Malaya, to chair the lecture and subsequently introduce Professor Dr. Chan Wah Kheong. Please welcome Professor Dr. Zamri.
Thank you very much, our Master of Ceremony. Today is very special indeed that we gather here at this very auditorium, TJ Tanah Raj, for a very special occasion. Respected Dean of the Faculty, yang berbahagia Datuk Profesor Dr. Yang Faridah, yang diraikan, the one whom we celebrate today, Yang Berusaha Professor Dr. Chan Wah Kheong, Professor of Medicine, Department of Medicine, Faculty of Medicine, and the family who are here today. Yang Berusaha Professor Raja Effendi Raja Ali, Dean, School of Medical and Life Sciences, Sunway University, thank you very much for joining us. Management of the Faculty, Management of University Malaya Medical Center. Distinguished guests, senior professors, lecturers, doctors, ladies and gentlemen who are joining the inaugural lecture, both physically here and virtually today. It is truly an honor for me to introduce Professor Dr. Chan Wah Kheong, a distinguished scholar, clinician, and researcher in the field of medicine. He is currently a professor of medicine, director of Division of Gastroenterology and Hepatology, and senior consultant gastroenterologist and hepatologist at the University Malaya Medical Center and University Malaya Specialist Center. Ladies and gentlemen, here is a proud alumnus of the University Malaya. Professor Chan graduated with distinction in 2005 exactly 20 years ago, and completed his membership of the Royal College of Physicians of United Kingdom 3 years later in 2008. And he returned to his alma mater 2 years later in 2010, where he pursued a fellowship in gastroenterology and hepatology, and later earned a PhD focused on non-alcoholic fatty liver disease, NAFLD, although you may see some terminology used at other places. His groundbreaking work of two-step approach for non-invasive liver fibrosis assessment has influenced both national and international clinical guidelines. Professor Chan has published extensively on NAFLD and other liver diseases, contributing significantly to Malaysian and global research in this field. He also has led and participated in various clinical trials and expert panels, including the Global Expert Panel for the ESSENCE study, ESSENCE study, and recognized as one of the top 2% globally in 2003 and 2004. Shall we give a big round of applause to Professor Chan for his achievement? Speaks volume about his dedication and impact. Ladies and gentlemen, Professor Chan has served in leadership roles in numerous prestigious organizations, including the Malaysian Society of Gastroenterology and Hepatology, MSGH, and the ASEAN Pacific Digestic Week. Professor Chan is also actively involved in teaching and mentoring, contributing to the training of future specialists and advancing clinical education as reviewers, editors, and many more. He co-authored a very famous reference text like Taylor and O'Connor's clinical examination, published by Elsevier. And this is a very famous and popular systematic guide for physicians' diagnosis. Every students and postgraduates carry this book with them whenever they go for ward rounds. Ladies and gentlemen, beyond his professional achievement, Professor Chan is a family man who cherished quality time with his wife, Lei Yong, and children. Thank you very much for joining us today, Brian and Elena. Guided by the principle of 3H, hard work, honesty, and humility, instilled by his mentors, who is not here to witness his achievement today, the late Professor Emeritus Dato' Dr. Goh Kin Lee. He embodied the spirit of a lifelong learning, collaboration, and service. Should he still be around, he will be very proud of you, sir. Today, Professor Chan will share his remarkable journey in fatty liver research, highlighting the themes of adding value, collaboration, and paying it forward. So, ladies and gentlemen, please join me in welcoming Professor Dr. Chan Kheong. Prof, over to you.
Testing. Yang Berusaha Professor Dr. Zamri Radzi, Deputy Vice Chancellor Student Affairs of University Malaya. Yang berbahagia Professor Dato Dr. Yang Farida Abdul Aziz, Dean, Faculty of Medicine, Yang Berusaha Professor Raja Effendi Raja Ali, Dean, School of Medical and Life Sciences of Sunway University, Management of Faculty of Medicine, Management of University Malaya Medical Center, distinguished guests, professors, doctors, ladies and gentlemen, friends and colleagues who are joining this inaugural lecture virtually and physically today. A very good afternoon to you, and I would really like to say thank you very much for taking time from your hectic schedule to be here today. It is really a great honor for me and a great pleasure for me to deliver my inaugural lecture entitled My Research in Fatty Liver, Adding Value, Collaboration and Paying Forward. First of all, I would like to thank Professor Gan Jinjin, Head Department of Medicine, because it was she who actually encouraged me to deliver this inaugural lecture, which is actually quite long overdue. I actually received my appointment for my professorship back in 2018. Thank you very much, Prof. Gan, for encouraging me to do this. And I would like to really start from the very beginning. This is a photo of my younger self with my parents. My father, Mr. Chan Yu Loy. Yes, sorry. My father, Mr. Chan Yu Loy, who is a retired motivational speaker. And my mother, Madam Tan Siu Lan, who is a homemaker. I am what I am today because of the unconditional love, nurturing, and support that they have given to me from my younger years into my adulthood. And I would really like to take this opportunity to thank them for all they have done for me and for being with me here today. Mom and Dad, I love you. I'm the eldest of 4 siblings, my younger brother Wawai, my sister Mei Yi, and my youngest brother Walong. Some of you may know him as Dr. Jack. He is now a clinical specialist in the Department of Medicine, also a fellow in gastroenterology and hepatology. So because my father was a motivational speaker, as we grew up, we get exposed to a lot of motivational quotes. And when he was preparing for his talk, he used to listen to motivational songs. And one of it is actually a very old Mandarin song, and the title is How, Hai Yao Gen Hao. So this is a QR code. You can actually scan it and listen to this old Mandarin song on YouTube. But literally, it translates to good, and we can be even better. And because of the motivation that we get, we have done well academically as well as in our extracurricular activities. And because of the good results, we had the opportunity to pursue our dreams. And for myself, is to become a doctor. And I was really grateful to have the opportunity to pursue medicine in the most prestigious medical school in the country, right here in the Faculty of Medicine, University of Malaya. This is actually a photo that was taken on the day that our results were announced in 2005. And it was a really proud moment for me when I graduated with distinction along with 3 of my other course mates. Throughout this journey in medical school, one of the most important things that I learned, that I continue to practice till today, is that as doctors, we cure sometimes, we relieve often, and we comfort always. And I continue to practice that when I see my patients in day-to-day practice. And after my graduation, I worked in the General Hospital of Kuala Lumpur and sat for my MRCP exam, and subsequently returned to University Malaya as a lecturer, where I started my academic journey. And today, in this inaugural lecture, I want to share with you the research work that I've done over the years, as well as lessons that I've learned. But more importantly, I'd like to express my gratitude to the wonderful people that I had the opportunity to meet, to work with, and to learn from throughout my academic career. They have really made my journey truly beautiful and fulfilling, and I would like to thank them from the bottom of my heart and wish them my very best. If you have the inaugural lecture book, you can actually find the acknowledgement section, and the people who I wish to acknowledge could be found there. And this QR code is really for friends and colleagues who are joining virtually. They can actually access the inaugural lecture book, the soft copy of it, by scanning this QR code. And of all the people I'm grateful for, my deepest gratitude goes to these 5 individuals. First of all is my mentor, the late Emeritus Professor Dr. Goh Kian Lee. Unfortunately, he is not here with us anymore. He left us in 2023. But his memories will forever live on in all of us. I'm also grateful to my senior colleague, Professor Dr. Sanjeev Mahadewa. And Dr. Nick Mustafa, who is a retired senior consultant histopathologist at the Hospital Sultanah Bahia Alostar Kedah. It was Professor Sanjeev and Dr. Nick Raihan who helped me a lot in the early days as I was carrying out my research project. I'll talk a bit more about that afterwards. And last but not least, I'm really thankful for 2 very inspiring figures that I had the opportunity to meet during my academic journey. And they are Professor Vincent Wong Wai Soon, who is Professor of Medicine, as well as Assistant Dean for Development at the Faculty of Medicine, Chinese University of Hong Kong. Vincent is also the head of the Department of Medicine and Therapeutics at the Prince of Wales Hospital. And together with Professor Grace Wong, who is actually the Assistant Dean for Learning Experience at the Chinese University of Hong Kong, they have really been an inspiring figure for me, and I will share with you a bit more as we go along. So with that, I'll move to the outline of my lecture today. I'd like to start by talking about the nomenclature change. There has been a name change for the medical condition that I've been doing research on, from NAFLD to MUFLD or MUSLD. And throughout this lecture, when I cite work that was done by others, I have used a green font intentionally. But if the work was of my own, either directly or indirectly, you will see the citation in black font. The term non-alcoholic steatohepatitis, or NASH, was actually first coined by Dr. Ludwig and colleague at the Mayo Clinic. So they noticed a liver condition that actually mimic alcoholic hepatitis and can progress to cirrhosis. But persons with this condition did not have any significant alcohol intake. Instead, they were moderately obese, and many of them had obesity-related diseases. And the term non-alcoholic fatty liver disease of NAFLD, or NAFLD, was used for a spectrum of liver condition characterized by excess fat accumulation after exclusion of significant alcohol intake and other causes of chronic liver disease. And the majority of these patients had obesity, and this was considered as the liver manifestation of the metabolic syndrome. However, there was some fundamental issue with this term. First of all, we know that more than one cause of chronic liver disease can exist in a patient. And the term NAFLD tells us what the condition is not rather than what it is. It does not attribute the condition to its underlying etiology. And because of that, Eslam and colleagues have actually proposed a new nomenclature for the disease: metabolic dysfunction-associated fatty liver disease, or MUFLD, that is diagnosed in a person with fatty liver who is either overweight or obese, has type 2 diabetes, or have at least one metabolic risk abnormalities, which were actually the criteria for the metabolic syndrome. And in addition to that, elevated HOMA-IR as a sign of insulin resistance, and elevated HSCRP level. So the paper became a landmark paper on the nomenclature change. Is to date one of the highest cited paper in gastroenterology and hepatology. The work was really led by Professor Jacob George, as well as Professor Muhammad Eslam from the University of Sydney. I had the pleasure to actually spend some time during my sabbatical with Professor Jacob George at the Storr Liver Center, which is affiliated with the University of Sydney and the Westmead Hospital. It was a truly fruitful and enjoyable experience for me. Professor Josh is brilliant and an eloquent presenter and an inspiring figure. The term MAFLD was quickly endorsed by the Asia Pacific Association for the Study of Liver in this clinical practice, as can be seen in this clinical practice guideline. And it was also endorsed in this letter to the Lancet of Gastroenterology and Hepatology by the Malaysian Society of Gastroenterology and Hepatology. And again, the Malaysian Society of Gastroenterology and Hepatology has came up with a consensus statement which included endorsement of the term MAFLD. And this work was a very special work, and I have to thank Professor Raja Effendi Raja Ali, who was the then president of the Malaysian Society of Gastroenterology and Hepatology, who actually commissioned this work. And it was also special because it was one of the very few work that actually involved all the different specialty relevant to the disease. We included not only gastroenterologists and hepatologists, but also endocrinologists, primary care specialists, as well as a representative from public health. We also have people from the Ministry of Health and Ministry of Higher Education, the different universities, as well as a representative from the private sector. However, the term MAFLD subsequently was not universally adopted. This was partly because there was lack of involvement of all stakeholders, and there was some concern about issues surrounding disease awareness, clinical trial, and ambiguity in the term metabolic dysfunction. And because of that, the American Association for Study of Liver Disease and the European Association for the Study of Liver led a consensus process that actually introduced a different term called metabolic dysfunction-associated steatotic liver disease, or MASLD, which is diagnosed in a person with steatotic liver disease and at least one of the cardiometabolic risk factors. And instead of considering people who take increased amount of alcohol together, it was considered separately, and there was an entity called MASLD and increased alcohol intake, or MET-ALD. Again, this led to another landmark paper in terms of nomenclature change. Both of these nomenclature has some differences, but both of them actually give a positive diagnostic criteria to the condition, as well as attribute the condition to its underlying etiology. It is a clear recognition by the hepatology fraternity that this disease is related to the metabolic syndrome and associated with visceral adiposity, low-grade meta-inflammation, and insulin resistance. For the next part of my lecture, I'll talk a bit about the epidemiology of the disease and its implications. For a long, long time, we do not have any population-based data for the disease. And while we were preparing the consensus statement for the Malaysian Society of Gastroenterology and Hepatology, I had the opportunity to work with Dr. Faizul Iswan Mustafa, who was then the Deputy Director for Non-Communicable Diseases at the Disease Control Division, Ministry of Health, Malaysia. I highlighted to him that Malaysia do not have data on the disease, although it's one of the most common cause of chronic liver disease. And at the time, I actually heard about a study that was going to be carried out in Perlis, so I suggested that perhaps we could try to look at MAFLD as part of the study. I'm sure a lot of you would have heard about the National Health and Morbidity Survey. This project gathered community-based data and evidence on non-communicable diseases and help the government review national health priority and program, as well as monitor the country's progress towards national goal and global commitment. And I was really, indeed, very thrilled when for the 2023 National Health Morbidity Survey, Dr. Wan Kim Sui, who is currently the head of the Center for Disease Burden Research, contacted me to ask me to join effort in this project to look at MAFLD at the population-based level. Dr. Wan is also here with us today. Thank you very much for being here. And for the very first time recently, we have our own national population-based data on NAFLD. The disease is indeed very common. It affects 28% of population, and this is despite using a higher cutoff of the non-invasive score, fatty liver index, which we have used in the study. If we were to consider those who were in the gray zone of the score, then this percentage will be even much higher. And when we use the fibrosis 4 index, which is actually a score for liver fibrosis, we found that 10% of people who have MAFLD may have increased liver fibrosis and are at increased risk of liver-related complications. And what is more alarming is that even though the prevalence of MAFLD is similar to the global average, our people actually suffer from the disease 10 years younger, and they have a higher prevalence of diabetes and hypertension, and therefore at risk of cardiovascular disease. This is certainly something alarming, and I'm really happy that Dr. Wan and his team has been doing a lot of work on this and using the data to actually try to raise the priority of MAFLD in national health agenda setting and to help us tackle with this condition. This is the National Strategic Plan for Non-Communicable Disease for the country. And the last I heard from Dr. Wan is that the next version of this for the next 10 years is being drafted, and hopefully we will see MAFLD in this document. This is the natural history of MAFLD. The incidence is about 50 cases per 1,000 person years. And some of the patient with MAFLD develop a more severe form of the disease called metabolic dysfunction-associated steatohepatitis, or MASH. MASH is really a histological diagnosis. The diagnosis requires a liver biopsy, showing not only fat, but also inflammation and ballooning. But the liver biopsy is an invasive procedure. It's associated with a small risk of complication, and the complication can be serious, including leading to death. So it's not really suitable for repeated assessment. Furthermore, a liver biopsy requires technical expertise, is costly, as well as limited by sampling and observer variability. Clearly, we need non-invasive tests. Patients with the more severe form of the disease, or NASH, can develop progressive liver fibrosis leading to cirrhosis. And we know that fibrosis is the single most important predictor of adverse outcome in this patient. And patients with cirrhosis due to the disease can go on to develop liver cancer. This is the work by Dr. Sumitra Ropini, who was at that time one of our medical students spending her elective period, looking at the etiology of liver cancer in our center. And as you can see, compared to an earlier study which was done by my mentor, Professor Goh, the underlying etiology being NASH, or cryptogenic cirrhosis previously, has more than doubled from 16% to 41% in the latest study. And it's only the second leading cause of liver cancer only after chronic hepatitis B infection. This is another study on a cohort of patients who had liver biopsy in our center. It was done by Dr. Jack as part of his master's thesis. We actually follow up a cohort of patients who had liver biopsy. They actually had a more severe form of the disease, whereby over 3/4 of them had steatohepatitis and over a quarter of them had advanced liver fibrosis. After a median follow-up of 7 years, as you can see here, liver-related event only occurred at 0.4 per 100 person years. Our patient with MAFLD has more cardiovascular event than liver-related event. Cardiovascular event occurred at 2 per 100 person years. And what we also found was that only patients with advanced liver fibrosis at baseline developed liver-related event. And using data from the same study, we found out that non-invasive tests such as liver stiffness measurement is as good as histology to predict adverse liver-related outcome. And this is also consistent with an individual patient data meta-analysis that we contributed data to. And this also forms the basis for using liver stiffness measurement as a risk stratification tool. A liver stiffness measurement is a non-invasive test. It's easy to do, suitable for repeated assessment, and the result is available immediately, and as mentioned earlier, as good as histology for prognostication. However, it's costly and not widely available. So ladies and gentlemen, friends and colleagues, you have heard that MAFLD is highly prevalent. Only a small, albeit significant proportion of patients actually have more advanced liver disease and have adverse liver-related outcome. So how do we identify these patients so that they can get the appropriate care? And how do we avoid unnecessary referral to the specialist clinic? We'll hold on to that question. And I shall allude to that as we move on to the last segment of my talk. As mentioned earlier, my academic journey started in 2010 when I returned to University of Malaya as a senior lecturer. At that time, Professor Goh was the head of unit. What he actually told me really resonated with me, that we need to practice what is called the 3H, hard work, honesty, and humility. And coming back to the university, the job is multifaceted. It's not only clinical service, but we also are involved in teaching as well as research. At the time, we were juggling work-life balance very much. We just had our first child, Brian. This is a photo of us celebrating his first birthday. It was also the time that about the time that I returned to University Malaya. The gastroenterology and hepatology unit in University of Malaya is recognized as a center of excellence by the World Endoscopy Organization at that time, and even till now. And it is no surprise that most people who actually come into the unit are interested to do endoscopy. You can see here the photo on the top left is actually a photo taken during one of our endoscopy workshop where the scope room was still at Menara Timur. We subsequently moved to Menara Selatan. Again, we have another photo during one of our endoscopy workshop. I too was really interested in endoscopy. Here are some photos of me doing EUS guided RFA and EUS guided pseudocyst drainage using hot axios, equipment which were then not available yet here in the country, but I was really interested in it. And this is also a photo of us doing ERCP with fellows from overseas. We have a lot of fellows, especially from the Philippines. It's really a pleasure to have them with us. And again, you can see photos of us during our work with all the nurses at the endoscopy unit. We work very well together as a team. The photo on your left-hand side is actually a photo taken with Professor Jong Ho Moon. Some of you all may recognize him. He is very well known for the ERCP procedure. And myself and Professor Ho Xiao Hui and Professor Alex Liao, we actually were very interested in ERCP and had the opportunity to spend some time at his hospital at the Su Chun Yang Bucheon Hospital to learn about ERCP. So with all the interest in endoscopy, how did I end up doing research in fatty liver? So I was a very obedient person, and I think it's the same for my colleague, Professor Ida. From what I know, she is also very interested in endoscopy, but now she is a world-renowned figure in inflammatory bowel disease. So at the time, Professor Goh told me, the first thing you do should be a systematic review. What's the status of the disease? Yes, Prof. We collected some data, ultrasound data on some students with Professor Anusha at the time, but there's no time to write it up. Can you write it up? Yes, Prof. We did a study a few years ago. We biopsied these patients. Can you call them back and see how they are doing, and maybe repeat a biopsy and see how they are? Yes, Prof. And after starting with those projects, Professor Goh actually sat me down and told me, he calls me John, by the way, so he gives an English name to all of us in the unit. My parents called me Jonathan when I was young, so Professor Goh actually called me John. And he sat me down, John, you are doing some work on fatty liver already, why not make it into a PhD project? This one I had to think a little bit. But eventually I decided to pursue it. So we actually conducted this study in the diabetes clinic. Thank you very much to Professor Shirini, who I believe is here in this crowd. Yes. And also at that time, Dr. Alex Andertan. So they actually allowed me to use some rooms in the diabetes clinic at that time to perform ultrasound on the patient with diabetes. But how did I learn how to do ultrasound? Thanks to Professor Anusha. Thank you very much. She actually taught me how to do ultrasound. And every Thursday morning, when Professor Ho Xiaohui was covering the therapeutic list, the endoscopic list, I was sitting in the diabetes clinic doing ultrasound. Okay, so, during that 6 months period, it was really intense. At that time, I had the help from the late Mrs. Manjit or Madam Tawan Ko. She also helped me to direct patient from the diabetes clinic to the room that I was in. I would quickly take blood for the patient and perform an ultrasound. Before the patient goes to the next room, where there are 2 dietitians waiting, because we also want to look at the patient's physical activity and dietary intake. And this is thanks to Dr. Ta Pei Chen from the dietary department. So she actually helped arrange some dietitian to be there to collect dietary intake data using food frequency questionnaire. So all this work actually led to some publication, 3 publications, as you can see here. But the mother of all research projects is really this project, which is actually a randomized control trial of silymarin for treatment of non-alcoholic steatohepatitis. And this project is really thanks to Professor Sanjeev at that time. I was early in my career, and it would not be in my dream to actually be the signatory of a fund at the time, if I remember correctly, about 200,000 ringgit. To sign my name there and saying that I'm responsible for the fund. So he actually was a signatory. And I also would like to take this opportunity to thank him very much. It's from him that I learned how to do ultrasound-guided liver biopsy. Okay, we did a lot of ultrasound-guided liver biopsy. And I would also like to thank him because he actually asked Madam Tawan Ko or Mrs. Manjit, who is his research assistant, to help with this project. And it was also Professor Sanjeev that introduced me to Dr. Nick Raihan from Hospital Sultana Bahia. Dr. Nick Raihan is a consultant histopathologist, and her support was phenomenal. We were sending her liver biopsy samples, and despite her hectic schedule, within a week or 2, we will get the results so that we can randomize the patient, because we had to randomize patient within a month. Okay, and without fail, he returned the liver biopsy result. And I really have to thank her for her support all these years. Some of the things that I learned during this project was that coming up with a protocol is very painful. So I spent many evenings staying back, drafting the protocol for the study. And I was very happy when it was ready and I submitted it, but it was sent back to me. I'm sorry, this looks like an executive summary. So it turned out that a proper protocol for RCT involving pharmacological agent, where we need to get the license and approval and so on, requires a protocol. I spent more time preparing it, and the document was about 100 pages long. And the other thing I learned is that a project can take many years. We actually started planning in early 2011. We were only able to start the study in 2012. And in fact, the company has already brought in the pharmacological agent, but by the time we wanted to start, it's already expired. And they need to bring in another batch. The last patient in was in November 2014, and we finished the study in 2016. By the time the paper was published, the company has changed name a few times. Imagine spending so much of time, okay, and for one project, and you know what if the project, the research outcome is a negative study? Well, we can still publish it, you know, but it's going to be more difficult to publish. But thankfully, the result was a positive one. And I was also very fortunate that at that time, we had the foresight to actually collect blood, which we have stored. And also, we used the FibroScan result that we have at that time. And that actually led to several other publications answering very important questions. But first of all, the main project itself has helped fill a literature gap. At the time, it's one of the largest single-center investigator-initiated RCT on NASH. We actually screened 148 patients, randomized 99 patients, and repeated biopsy in 89 of these patients. And as mentioned earlier, I'm very thankful for Professor Vincent Wong and Professor Grace Fong from the Chinese University of Hong Kong. At the time, there were not many who there were not many from my unit who were interested in hepatology. Okay, so attending these conferences overseas in the US and the Europe can be quite lonely. And I was very fortunate to get to know them, and they have been very supportive. In fact, this picture taken in 2015 is in Vienna was actually the time that I went to present the interim result of the Silymarin study that I mentioned earlier. When they heard that I was presenting a poster, they actually, despite their hectic schedule, they actually came by and gave words of encouragement and word of support. And from then, we developed this friendship that I will forever treasure. And again, when we presented the final result in 2017, Amsterdam, you can see, again, they were actually there. And over the years, I'm very grateful to Professor Vincent Wong, to Vincent, because sometimes when when I meet with difficult situations, I do contact him to ask for his advice, and on multiple occasions, he has been extremely helpful. So as mentioned earlier, from the main project, we actually had some sub-project which actually answers some very important questions. These are 3 papers that came out further from the original study. So one of it is actually looking at control attenuation parameter, which is something we also measure when we do FibroScan, and to look at how it's used to detect fat in the liver. And in fact, the paper that we wrote, because liver stiffness measurement came out first, and then the company introduced a control attenuation parameter subsequently. And it so happened that at the time when we did the study, we had liver biopsy and we had control attenuation parameter. So we can then look at how control attenuation parameter can be used to measure fat in the liver. And we were actually one of the very first few to publish a paper on CAP in NAFLD. And at the time, I actually received an email from Dr. Celine Fournier, and she has asked whether we are willing to share our data, which we agreed. And in fact, during the EASL meeting in 2016 in Barcelona, it was a really memorable experience for me, because it was the first time at the international level that I have met with strangers to actually look at data of our own. They actually analyzed the data and told us that, you know, your data is very good. We would like to include it for work that we are doing. This is a photo with Dr. Celine Fournier and Dr. Magali Sasso. They were actually scientists from EcoSense, the company that developed FibroScan. And because of that, data from our center has been included in this individual patient data meta-analysis, which became the landmark paper for all subsequent studies that use CAP for measurement of fat in the liver. So from this, I learned that the power of a team pulling together, working for the same goal, striving to reach a common destination, is far greater than the sum of its parts. The other thing that I managed to look at was liver stiffness measurement and fibrosis. But this is not something very new. People have already published on it. So I thought I would try to look at it slightly differently. What if we use a non-invasive fibrosis score like the NAFLD fibrosis score and liver stiffness measurement? Theoretically, if you use two tests, it should be better. But what we've actually found was that when we use these two tests together, it actually creates more indeterminate or discordant result. Because there are a lot of patients who have got a low NAFLD fibrosis score, who have got a high liver stiffness measurement, even though they do not have advanced fibrosis. And this is because of the false positive of liver stiffness measurement in these people. And because of that, we actually propose a two-step approach where we will first use the NAFLD fibrosis score, and because it has got very high negative predictive value, people who have got low NAFLD fibrosis score are unlikely to have advanced fibrosis, and only those who have elevated fibrosis score should go on to have liver stiffness measurement. So those were the work that I did that culminated in my PhD thesis. So altogether, there were actually 9 papers published. The paper on silymarin was not published yet at the time. As mentioned earlier, it took a very, very long time. But those were the projects that led to my PhD thesis. And in the same year, I actually had the opportunity to join this group, and this is thanks to Professor Goh at the time, who asked me to join in the first meeting of what was called the Gut and Obesity Asia Work Group. The short form for it is Go Asia. Sounds more like a tourism campaign. And this is the second meeting that we had in Taiwan during EPIDW. So at that time, myself and Professor Vincent Wong was actually tasked to lead a project on fatty liver across multiple centers in the Asia-Pacific region. I was, of course, very nervous. I've never done this before. Okay, but you know, if someone offers you an opportunity, you are not sure if you can do it, say yes first. Okay, then learn how to do it later. So from there, we thought the easiest thing to do would be to collect existing data from all people who are interested to participate. Okay, so we brought together over 1,000 liver biopsy results. And we looked at these patients, and we found that diabetes was actually a very important predictor of more severe fatty liver disease. Okay, it's an independent predictor for steatohepatitis. It's also independent predictor for advanced liver fibrosis. And after a successful first project, I became more confident. So we went on to a second project, and we got more people involved. And I thought it was a good chance to actually look at the two-step approach. Because the earlier study we did only had just a bit over 100 patients, small sample size, from Malaysia. So now we have data from multiple centers. So we then look at the two-step approach, and we were able to refine and validate it. Okay, first of all, we found that the fibrosis 4 score was just as accurate as the NAFLD fibrosis score. Okay, and this is despite the fibrosis score 4 score only requires several parameters. It requires less parameter than the NAFLD fibrosis score. It just requires the age, ALT, AST, and platelet count. Okay, so we can easily calculate it using readily available parameter. The second thing we found was that using a 10 and 15 kilopascal cutoff was actually as accurate as using the 8 to 17 kilopascal cutoff, but resulted in lower indeterminate or discordant result. Moreover, the 10-15 kilopascal cutoff was also becoming popular because of what is called the Baveno 6 criteria. And because we have a huge sample size, more than 1,000 biopsies, we were able to look at the performance of this two-step approach in population with different prevalence of advanced fibrosis, low prevalence as well as high prevalence. And we show, similar to the original study, that in a population with low prevalence, such as the general population, the negative predictive value is very high. The false positive rate is less than 2%. However, in a population with higher prevalence of advanced fibrosis, the false negative rate is slightly higher, between 10 to 15%. But in this population, when we actually use the combination of elevated fibrosis 4 score and elevated liver stiffness measurement, is predictive of advanced fibrosis in up to 90%. So back to the question that I brought up earlier, we have a disease that is very common. Okay, only a small proportion have more advanced disease and will be at risk of liver-related event. So how do we make sure these patients are identified and referred to specialist care when most of them are actually asymptomatic? Okay, how do we avoid unnecessary referral? So this is a study that I've shown earlier from the Go Asia work. We know that diabetes is an important predictor of steatohepatitis and advanced fibrosis. And this is actually a project conducted by Dr. Lai Lili from Nursing Science for her PhD. She actually used FibroScan in the diabetes clinic and found a high prevalence of fatty liver, and 20% actually have elevated liver stiffness measurement. And when those patients with liver stiffness measurement more than 8 kilopascal went for a liver biopsy, majority of them actually have steatohepatitis and some degree of liver fibrosis. So again, it shows us fatty liver is highly prevalent in patients with diabetes, and they are at risk of more severe liver disease. And I would really like to take this opportunity to thank Emeritus Professor Chan Siu Ping, who was at that time the president of the Metabolic and Endocrine Society of Malaysia, and was the chairperson for the clinical practice guideline on management of type 2 diabetes. It was, I believe, sometime in the last quarter of 2020 that she contacted me. Kheong, you know, we are doing this clinical practice guideline. I think we would like to include fatty liver inside the guideline. But you know, we are in our final draft. Do you think you can get it done within a month? Wait, 2 weeks will be better. But this is a golden opportunity. I dropped all the things that I need to do at that time. I work on it, but because I was fortunate in the sense that I was doing some work on it, and I'm quite familiar with the literature at that time. So we actually managed to squeeze in fatty liver assessment in the type 2 diabetes guideline. I wouldn't take you through too much details, but basically we incorporated the two-step approach where we use the fibrosis 4 score, and those with elevated fibrosis 4 score are recommended to go for liver stiffness measurement. And we were actually one of the first countries in the world to actually have assessment of the liver in the type 2 diabetes guideline. And this was actually highlighted in this report, this white paper by the Economist Intelligence Unit, citing that, you know, this is something that may help us to fight the disease. And, you know, for a long time, our colleague in endocrinology have had a very good system to assess target organ damage in patients with diabetes, you know, and we don't really need to reinvent the wheel to try to look for fatty liver ourselves in this population. So it makes a lot of sense to include assessment of fatty liver in patients with diabetes. And we are also probably one of the few countries in the world whereby assessment for fatty liver comes first in the type 2 diabetes guideline before the gastroenterology and hepatology society guideline. But still, this is a very important work. And again, as mentioned earlier, Professor Raja Effendi was the president at that time, and thanks to him, commissioned this work. And again, you can see we use the two-step approach, fibrosis 4 followed by liver stiffness measurement. And recently, we updated this, and I would really like to take this opportunity to thank my colleague from my team, Professor Chua Ki Huat and Dr. Ruvina, as well as Prof. Shirini, Prof. Lim Li Ling, and Prof. Jayakanta from endocrinology. This paper was actually published in 2023, and in this journal called Journal of Obesity and Metabolic Syndrome, which is the journal for the Korean Society of Obesity. And you can see within a year, it has attracted over 200 citations. So I'm actually very happy that a work that actually came solely from members of the Department of Medicine here at the Faculty of Medicine is highly cited by people around the world. And this two-step approach is not something that is found just in the Malaysian guideline or the type 2 diabetes guideline, but it's also what is basically found in the European guideline, as you can see here, as well as the American guideline. And I think it's very important that we always stay up to date with what is happening so that we can actually know what the literature gap is and therefore focus on our research work to fill up the literature gap. And one of it is by attending conferences. So this is particularly memorable for me because I was actually waiting for a collaborator so that we can have a meeting together. And this collaborator actually told me, let's wait at the poster viewing area. So as I was waiting for him, I was just looking at the poster, and I stumbled upon this poster on a novel risk score for fatty liver, just by chance. And the study was done by a group in the United Kingdom. I took down the first author's email. And that evening itself, I actually dropped him an email saying that, we actually have data, and perhaps we can work together. And surprisingly, I actually got a very quick response saying that, sure. And this person actually connected me with Dr. Celine Fournier. If you remember earlier, we actually shared data on CAP for liver fat. And so happened that while I was waiting for my flight back to Malaysia, I bumped into her again. We actually shared data. And this led to this work, and I was very proud of it because it was presented at the plenary session in the American Association of Study Liver of Disease meeting, whereby the original training cohort was from the UK study, and they actually validated in 3 cohorts. Okay, the French bariatric cohort, the US cohort, and the Malaysian NAFLD cohort. And this actually led to a publication of this work called the FAST score, which is nowadays used a lot for screening of patients for clinical trial. Another way to keep ourselves updated is to look at email on the latest content from journal. So we receive email from journal telling us, this is what is found in this issue, and one of these paper that I so happened to see was on a new score called MAC3. Okay, and at the time, for a short period of time, the author actually provided the calculator online, and it was just for a brief period, I believe. So, and I stumbled across this, and I had the data, so I just needed to use that calculator, and I got the results, and that led to a publication of this paper in Liver International, which is one of the first few to validate this score, and subsequently we were fortunate enough to be invited to contribute to this international study on a much larger cohort of patients. A collaboration also exposes to a lot of latest development in the field, and I'm really fortunate to be able to have the opportunity to work with different groups from across the world. This is the Global NASH Council led by Professor Zobir Yunusi, and this is the first meeting that we actually attended. We consider ourselves as a representative from the Go Asia group. I had the pleasure to attend this meeting with colleagues from Singapore, Professor George Goh, Professor Dan Yok Yang, Professor Vincent Wong as well, colleagues from India, Professor Ajay Duseja, and colleague from China, Professor Jiang Gaofan. And these are some of the publications that have come up through the collaboration. And I would really like to mention again that I'm very fortunate to be able to have the opportunity to collaborate with the team from the Chinese University of Hong Kong. Whenever we meet during the American and European meeting, as well as regional meeting, we take the opportunity to catch up as well as to share ideas. And these are just some of the selected publications from our collaboration. I also had the chance to work with this CAP Asia study group led by Professor Vincent Wong from the CUHK and Professor George Goh from Singapore. These are examples of some selected publications. And recently, there's a huge database in this project led by Professor Vincent Wong, and we are generating a lot of landmark papers from this work together, including this paper that was published in JAMA last year. I also had the opportunity to work with Professor Minghua Zheng from the Muffley Research Center in Wenzhou Medical University. He has got a very active team and producing a lot of excellent work in recent years. Collaboration is not only in terms of research work and publication. I'm also very happy to be part of the faculty for the Singapore Hepatology Conference, which I've been attending since 2017. This is actually the brainchild of Professor Lim Senji from the NUHS, and it's an opportunity for us who are interested in this field to meet together. And recently, the Singapore Muscle D Symposium was introduced. This is a prestigious meeting in this region. When we collaborate, we will be able to validate our observation in different populations. We will have a larger sample size. We are more confident in our observation. And there's always advantage when we submit a paper for publication. And when we work with different people, as they carry out their work, they will also cite the paper that was published together, and this leads to more citation. But most importantly is the friendship and support, because friends make the world beautiful. So after obtaining my PhD, I feel that it's important that I share what I've learned with my students and younger colleagues. So this is just some photos taken with medical students who spend their elective period in our unit. This is a photo on your right-hand side is a photo of Dr. Eugene, who is one of our master's students as well. They were very happy to present their work in our MSGH GUT meeting. This Dr. Sumitra I've shown earlier. She not only presented the work in our local meeting, but had the opportunity to present the work in Hong Kong during Epidemiology 2017. This is a photo taken in the MSGH GUT meeting in 2018, where Dr. Lai Lili, who did her PhD with me, so she presented her work during the meeting as well, together with Dr. Emily and Dr. Shaman, who was nicely introduced to me by Professor Anusha. One of the things that I try to emphasize is that an abstract should lead to a publication. So we don't want to have a lot of abstracts in meeting, but they don't lead to a publication. So we should always encourage our colleagues to, or students to publish the work that they have submitted as abstract. And in 2018, I was elated to receive my professorship. I'm very grateful for that. And continuing on, I was helping my colleagues who are advancing in their academic journey as well, presenting work in regional meetings. This is a photo of Professor Chua at that time, but now Professor Chua is actually a key opinion leader now in functional GI disorder in his very own right. And also Dr. Stanley Koo, who is now a key opinion leader in US guided interventional procedures. He's highly skilled, and he's one of the very few people who can do some very advanced procedure here in this country. And in 2019, I actually had the opportunity to be a faculty at this Young Clinician Investigator program, which is organized during the APDW. Thanks to Professor Rakesh Agarwal, who was the convener of this program. And in 2020, there's a new addition to my family. We have our daughter. But at the time, it was a difficult time for everybody, because at the time it was about COVID time. Okay, so I still remember we were very happy when we actually won the bid for the Asia Pacific Digestive Week to be held here in Kuala Lumpur. We actually went to Hong Kong to bid for it in 2017, and we won the bid. We were so happy. Professor Raja Effendi was actually the president for this meeting. Unfortunately, COVID hit. Yes, we were thinking wawasan 2020 to have this meeting. And so we postponed it to 2021, thanks to the Epidemiology Foundation, who agreed to that, hoping that we would be able to organize it physically. But still, COVID was still around, and we had to hold the meeting virtually. Okay, and because we held the meeting virtually, we actually were able to have more participants in the Young Clinician Investigator Program. And during this time, because we were the hosts, we were in the organizing committee for EPIW. I was actually working with Professor Rakesh to have this Young Clinician Investigator Program being held. And because we did not need to give a big travel grant to participants, in previous meetings, we could only support 70 participants. But in these meetings, we were able to support 300 young clinician investigators from across the Asia-Pacific region to attend the program. And this is just photo showing medical students, Dr. Felicia and Dr. Shien, who spent their elective doing research work in our unit. And Dr. Liao, who has graduated at that time, Yong Wen, and Dr. Jack as well, presenting their work during our MSGH CAT meeting in 2022. 2023 was a special year. So first of all, Dr. Jack did work under Professor Chua on fatty liver disease, which I presented earlier. And the poster was actually accepted for presentation in ESO in Vienna. So I had the opportunity to travel with him to this meeting. Secondly, is the work by Dr. Liao, Yong Wen. So Yong Wen is actually one of my medical students. During her third year elective, she did a research with me. She got a paper published. And after she completed her studies while waiting for her housemanship, she came back again. And during the time, she actually published 3 papers. And one of the work that she did was actually on a new AI-based score, okay, and the company has actually agreed to support her to present this work in the ASLD meeting in Boston. So she actually traveled on her own all the way to Boston to present the work. And what I'm even more proud was that when she submitted the abstract, she actually applied for the Professor Mindy Nguyen Award for Outstanding Clinical Research by Early Career Investigators. And she actually won the award. And I was really surprised, because at the time I was working with Professor Mindy on a review article. And she actually dropped me an email congratulating me on Yong Wen's success. And it was really a very proud moment for me. And in 2023 is also for the first time I have been given the responsibility by Professor Rakesh Agarwal, who is now the JGH Foundation Trustee Chair, to be the convener for the Young Clinician Investigator Program. And this was actually held during the EPIDW in Bangkok. And last but not least, 2023 was also the first time that I received this honor to be the top 2% scientists in the world in their respective field. And I was really proud to be in this list with my teachers, Professor Adiba, Professor Goh, Professor Liam, Professor Sanjeev. All of them are my teachers. And I would really like to highlight here that we really have a rising star, or already a star, in her very own right, Professor Lim Li Ling. You all may not know that Li Ling is actually 1 year my junior in medical school, so she graduated in 2006, right, Li Ling? 7, okay, 2 years my junior in medical school. Okay, and she's doing phenomenal work, and I really look forward to her upcoming inaugural lecture. And this is in 2024. So some of you may know that this inaugural lecture was initially meant to be on 17 December 2024, but because we have our alumni dinner on that day, so it was postponed to today. But actually 17 December 2024 would have been the 21st anniversary of marriage registration with my wife. And I actually really wanted to thank her for going through this journey with me all these years. She's an ophthalmologist and oculoplastic surgeon herself. And I'm really grateful for the experience that I have to being a husband and a father to two beautiful children, Brian and Elena. I love you. I'd just like to finish off by... I love you too. I'd just like to finish off by showing a few slides. So these are some of the photos that I've taken with some students. Some of them are already back here being academic staff. Photo with Lily when she graduated in her PhD. Photo with Yongwen when she came for graduation. Photo with Wei Kei, who is also now working in our department, as well as a lot of other students who I'm really grateful to be able to share experience with and to learn from. My research work would not have been possible without the able support from the research team, research assistants. I actually remember every one of them by name. And I'm really thankful for their help. And I'm also very thankful for my family, my mother-in-law, Madam Ha Koi Hong. So she has been helping us look after our children when both of us are busy at work. Otherwise, we would not be able to cope. Thank you, Amma. And to my family that we should meet more often. This is a photo taken during Chinese New Year, the whole family. But that only occurs once a year. Perhaps we should do it more often. And last but not least, I'd like to thank all my colleagues in the gastroenterology and hepatology team. Without their guidance, support, covering each other, we are a great team. And I'm really thankful for that. This is a photo taken in 2023, and this photo is more recent in 2024. I'm also thankful again to the CUHK team, Professor Vincent Wong, Professor Grace Wong, and Professor Terry Yip. And this last photo here is really, a photo of the rising stars of gastroenterology and hepatology. I had the opportunity to take this photo with the fellows in our unit at the moment, Dr. Ang Ban Hong, Dr. Ram Prasad, Dr. Keith Leong, and Dr. Jack. And also Dr. Julian Inaki, who is our fellow from the Philippines. There's a Chinese saying that goes, 一代比一代好. Okay, so the next generation should be better than the last. I would just like to end by sharing this, which is something I find to be very meaningful. We shouldn't quit. So when things go wrong, as they sometimes will, when the road you are trudging seems all uphill, when the funds are low and the debts are high and you want to smile, but you have to sigh, when care is pressing you down a bit, rest if you must, but don't quit. Life is queer with its twists and its turns, as every one of us sometimes learn. And many a failure turns about when they might have won had they stuck it out. Don't give up though the pace seems slow, you may succeed with another blow. Often the goal is nearer than it seems to a faint and faltering man. Often the struggler has given up when he might have captured the victor's cup. And he learned too late when the night came down how close he was to the golden crown. Success is failure turned inside out, the silver tint of the clouds of doubt, and you never can tell how close you are it may be near when it seems so far. So stick to the fight when you are hardest hit is when things seem worse that you must not quit. And there's a video that I would like to show at the end of the talk. This is actually a QR code that links you to the video online, but I'll just show it here.
A lot of money, and so he went to this guru, right? He told the guru, you know, I want to be on the same level you are. And so the guru said, if you want to be on the same level I'm on, I'll meet you tomorrow at the beach at 4 a.m. So the young man got there at 4 a.m. He all ready to rock and roll, got on the suit. The old man grabs his hand and said, how bad do you want to be successful? He said, real bad. He said, walk on out in the water. When he walks out to the water, it goes waist deep. So he's like, this guy crazy. I want to make money. He got me out here swimming. But the old man said, I thought you said you wanted to be successful. He said, I do. He came, dropped his head in, held him down, hold him down. Just before my man was about to pass out, he raised him up. He said, I got a question for you. He said, when you were underwater, what did you want to do? He said, I wanted to breathe. He told the guy, he said, when you want to succeed as bad as you want to breathe, then you'll be successful. And I'm here to tell you, number one, that most of you say you want to be successful, but you don't want it bad. You just kind of want it. You don't want it badder than you want to party. You don't want it as much as you want to be cool. So what I'm telling you is, when you want something bad, you can't count the cost. Because if you count the cost and you see how much it costs, you might quit. You might give up. So you got to go in knowing that I don't count the cost. Listen to me. You don't count how many breaths you take. You don't count it. You get to a point where you don't count it. You just do whatever it takes to get whatever you want.
Thank you. Thank you very much.
Thank you, Prof. Chan, for a very inspiring lecture. So, ladies and gentlemen, now I would like to invite Professor Dr. Zamri back to the podium to summarize and conclude today's inaugural lecture. Thank you.
Shall we give another big round of applause to our Professor Chan? Ladies and gentlemen, this is what they say about inaugural lecture, especially inaugural lecture. That inaugural lecture is truly a testament to scholarship. Hearing directly, firsthand, from the Don himself, from the expert himself, is truly amazing and extraordinary. Prof, we enjoy every slide of yours. We enjoy every photos that you shared. We enjoy every tables that you display. And this is the highest number of QR code that I have ever snapped in one inaugural lecture. So, ladies and gentlemen, Professor Dr. Chan, Kheong, thank you so much for inspiring such an inspiring and insightful presentation. Your journey in fatty liver research reflects not only your dedication to advancing medical science, but also your commitment to collaboration and mentoring the next generation of clinicians and researchers. Just now we saw the photographs of you and your family. We are deeply touched. And this is what inaugural lecture is all about. It's not just to treasure the achievement, but also to reflect the past. Those who are with us throughout the journey, especially the parents, the family, and the colleagues. Thank you very much. Shall we give this big round of applause to Mr. Chan Yu Long, Madam Tan Siu Lan, Wawai, Mei, Walung, and especially Dr. Lei Yong, Brian and Elena. You must be very proud of your dad. So, Prof. Chan, through your work, we have seen how patient, perseverance, and a vision for a better tomorrow can lead to impactful contribution in the field of medicine. Your effort in developing innovative approaches for diagnosis and managing liver diseases has not only benefited patients, but have also set benchmarks in clinical practice and research, both locally and internationally. Speaking about international, it just clicked just now that during the Asian Medical Dean Summit hosted by UM a few years ago, not long, I met with one of the dean of the university, the top university in his country, the largest country in ASEAN. He spent some time at your division, at your department, speaks very highly of Prof. Chan Kheong. You, your mentor, and your senior. Now I realize that he's talking about this very special man. So he speaks very highly of you and talk about great things that you have done and your senior and your department has done. And many of us who are not here in this very auditorium may not aware, those who are not here may not aware that this very faculty has published highest quality of scientific papers that we can trace back since 1967, 68, series of Lancet papers, New England Journal of Medicine, that we did not realize that long before people are talking about the university ranking, about the Scopus, about the other than Scopus, University Malaya has produced so many great papers. And you continued this tradition. We saw many of your papers, not only in highly specialized journals, but highly regarded journals, one of the Lancet series of your disciplines, and many more. We are very proud of you, Prof. We also see the photos of your class, 2005. And I'm very proud that one day Professor Young, Datuk Professor Young shared with me the photograph of the hall, lecture hall, that despite having through this major renovation, she still maintained the bench and the furniture that brings back the memories of the alumni and the future alumni. Thank you very much, Datuk, for maintaining such precious. Ladies and gentlemen, there are many things that we can talk about this great man, but he will be one of our very best, Professor Don. And we now will remember, Prof, not only you, but everyone inside your photos, those who are here today, and we now understand why they are here. Prof, thank you very much, our Dean of Sunway. Thank you very much for being here. Now we know. And Prof, thank you very much. Thank you very much for being with our Professor Chan and our senior professor. Thank you very much. On behalf of the university, everyone here, our Dean of the Faculty, and University Malaya as a whole, I would like to express our deepest gratitude for sharing your expertise and your experiences with us today. You have truly embodied the values of, as you said, the 3H, hard work, humility, and the other one, and paying it forward. And we are inspired by your achievement and dedication. I'm sure those who are listening and watching this online, the new generations of the medical students, will be inspired by you, and one day will say that, I remember the day when we watched the inaugural lecture, and that was in 2005, delayed because of the alumni dinner. It was Me who, one of them that you can blame, because I was involved directly as well with the alumni dinner. But we like to take this opportunity to say happy anniversary, the 21st one, both of you. Ladies and gentlemen, let us once again extend our appreciation to Professor Dr. Chang Kheong for this remarkable inaugural lecture. Prof, we are most proud of you. Thank you once again, and thank you for being part of this University of Malaya. Thank you, Prof.
Thank you, Professor Dr. Zamri Radzi, for chairing this inaugural lecture today. And to commemorate today's event, we have our session, photography session. So, yep, they are on stage. Okay, next I would like to invite everyone to join Prof. Chan for a picture. So I will have a humble request that move everyone to the middle of the auditorium. And okay. Okay, so everyone move to the center and then everyone stand up. So for a clearer picture, yep.